My name is Saima, one of the junior doctors working in the department. Can you please confirm your name and age?
Yeah, doctor. My name is Julia and I am 32.
Nice meeting you, Julia. So, how can I help you today?
Actually, doctor, it's like I'm coming today to see my child, and I
Mm-hmm.
got so much disappointed when I see that she was covered in poo.
Oh, okay. All right. I'm so sorry to hear that you felt that way. But can you please tell me more about it? Can you please confirm the name and age of your child first?
Yeah, doctor. Her name is Amy, and she is 5 months old, doctor.
All right. So, can you please tell me why exactly Amy is admitted in the hospital?
Well, doctor, she was born premature, so she's here in the hospital since then, and I'm visiting her regularly. But
Mhm.
I'm so disappointed these days because every time when I'm coming here, she's covered in poo, and today it was limit for me, doctor. I can't tolerate this anymore.
I can see that you are really worried, and being a very loving mother, I can't even imagine that how are you feeling right now. But I've first of all, I'm really sorry that you felt that way, and I will try to look into this matter and see what has gone wrong. But I would like to ask you a few more questions about the admission and stay of your child in the hospital. Is that okay?
Okay, doctor.
So please tell me, you told me that your child was born premature and he was admitted in the hospital. How was the birth of your child?
Well, doctor, they had to do emergency cesarean for me, and then
Mm-hmm.
after that, she was in uh, PEDS ICU for some time, but right now she's in ward.
Mm-hmm. And is she up to date with her jabs?
Yeah, doctor.
All right. And is she feeding well?
Yeah, like I think because uh, the nurses are telling me that she's feeding well. They used to tell me about that, but right now, doctor, I have another complaint as well. They are not talking to me properly when I am talking to them about my child's eating, and like I am talking to them about the details of my child. They are not aware of that. Every day
Mhm.
I am seeing there are some new faces, and they don't know anything about my child, doctor.
Oh dear. It seems that you are really upset. I'm so sorry that you felt that way. Um, well, I will look into this matter as I'm the first. I am listening about it for the very first time. I will look into this matter that what gone wrong and where, and I will talk to the nurses as well regarding it. And I will try to look into this matter and get an idea of what is going on. Is that okay?
Yeah, okay.
And I will also ask the nurse colleagues to come to you and talk to you regarding it. How does that sound to you?
Well, doctor, I don't want to see their faces because they are so rude. When I'm asking anything, they are not listening to me. And then after that, like when I'm gone, I think I try to talk to their supervisor as well, but she told me that it's not their job to look after. Okay, it's their job to look after my child, but they told me that it's not their job to clean my child.
All right, all right. Well, I'm so sorry they that you felt this way. I'm really apologetic on the behalf of my team. However, you know that you just mentioned that whenever you come, you see new faces, and now you talked about nurse colleague. Sometimes, you might have visited them at different times of the day, and you have visited different nurses, and sometimes they have quite busy because of some hectic day routine, uh, and they are not that vigilant at times. But whatever they said and did, I believe that it is completely that is, I'm not on their side. I won't say that that was right, and I will talk to them regarding it, and I will see what the things went wrong. Is
Yeah,
that okay?
doctor. Yeah, doctor. They are misbehaving with me, and they are not even answering my questions. And when I'm trying to ask them anything, they start
Mhm.
misbehaving with me, and they're very rude, doctor. This, like, I'm not satisfied with the care you are providing to my child here. Previously, when she was in ICU, all the people were so good there. They were so nice to me. They were looking after her properly, and at that time I was happy. But since she has been shifted to this ward, everybody is so, I feel that they are neglecting her. I don't know why, but she is my baby. I can't see her like that.
I can understand from where it is coming, and please accept my sincere apologies that you felt that way. I will talk to them regarding it, and I will also talk to their senior nurse regarding it. And if if you believe that they are misbehaving with you, then that kind of behavior is not acceptable at all. I will look into this matter and try to get in detail regarding it. And may I tell you what else can I do about it for?
Well, doctor, I want you to appoint a senior nurse who can look after my child because all of them, they are new and I don't want them to touch my child.
I can understand your concern, and well, I will talk to the senior nurse regarding the care of your child. However, it is not possible to for a single nurse to take care of your child all the time because they work in shifts and the shift change. However, there is a very strict method and they follow it strictly of handing over the patients. And I will ask them to be more careful regarding your child next time. Is that okay?
Well, yeah, it sounds good, doctor, but I was thinking that maybe I can shift her to a private setup. At least they will be able to take care of my child properly there. I'm not happy at all.
Okay. Well, I'm so sorry that you have felt that way. And we will try our best to rectify our mistakes if there are any and there are any loopholes in our care. However, being the mother of your child, it's your right to make the best decision for your child. And if you want that thing for your child, you can. No, but however, we will try our best to improve ourselves and rectify our mistakes. How does that sound to you?
Okay, doctor.
Okay. Hello.
Hello.
My name is Saima, one of the junior doctors working in the department. Can I please confirm your name and age?
Yeah, doctor. My name is Julia and I'm 14.
Nice meeting you, Julia. So, how can I help you today?
Um, well, actually, doctor, I just want to make sure, is this conversation confidential?
Yeah, absolutely, Julia. You can talk to me about anything you want to. It will be between you and our team.
Okay, doctor. Well, like, I don't want you to tell this to my mother. I know she can call you sometime as well, but I
Mhm.
just don't want you to tell her. Okay?
All right. Well, Julia, whatever conversation we will have, that will be between you and us. And don't worry, we will not tell anything to anyone until and unless it's extreme necessary for your own safety. Otherwise, we will not disclose anything without your consent. All right?
Yeah, okay. Well, doctor, actually, I'm here to get some morning after pill.
Mhm. All right. All right. No issues, Julia. I can prescribe you a morning after pills. However, I would like to ask you some general questions regarding your overall health before. Is that okay?
Okay.
So, Julia, please tell me, why do you need these morning after pills today? Is there any particular reason?
Well, yeah, doctor, like we had an unprotected sex yesterday, so I'm really worried.
Mhm.
So I came
All
here to
right,
get a pill.
all right, okay. May I know from where did you know about these morning after pills?
Everybody knows that, doctor. It's in our college magazine and on social media, you know?
All right, all right. Well, I would like to ask you a few questions regarding your periods and your sexual history. I hope you don't mind. Is that okay?
Yeah, sure.
So please tell me, how are your periods? Are they regular?
Yeah,
And when was your last menstrual period?
it was 2 weeks ago.
All right, all right. And can you please tell me more about your partner?
Well, what you want to know, doctor?
Well, I want to know about your how is your relationship with your partner these days?
Well, it is fine.
Hmm. And since when are you in relationship with your partner?
Um, it's been 6 to 7 months now.
All right. So, Julia, can you please tell me about your partner? How old is your partner?
Well, doctor, actually, he's my music teacher.
Okay. All right. And he's your music teacher, and you are in relationship with him for the last 6 to 8 months. Am I right?
Yes, doctor.
Mm-hmm. So, you told me that you are having a good relationship with him. Am I right?
Yeah.
Okay. So, um, Julia, please tell me, do you have any diagnosed medical condition?
No, doctor.
Any medications you are on?
No.
All right, Julia. So, have you ever used these morning after pills ever before?
No.
Mm-hmm. Well, Julia, sometimes people who have, they are in relationship, they might have some problems, or they are having some issues with their partners. Sometimes they do not feel to be in that relationship, and or they are not very happy. However, they are sometimes, find themselves caught in the situation. Have you ever felt anything that is overwhelming to you in being in a relationship?
Um, no, doctor.
Mm-hmm. All right. Okay. So, have you talked to anyone regarding your relationship with Julia?
Yeah, doctor. A friend of mine, she's my best friend, and she knows about it. But I have not talked to my family about it.
Mm-hmm. Has your partner asked you not to tell anyone?
Yeah, like he's my teacher, and we know that he can face some consequences. So we don't want to share this with anyone.
All right. All right. Thank you so much, Julia, for answering my questions so far. I would like to examine you, and first, I would like to check your heart rate, blood pressure, oxygen saturation, respiratory rate, and I will also like to examine you from head to toe in general and examine your tummy. Is that okay?
Okay, doctor.
And I will also like to run some initial blood tests, including your full blood count, urine electrolyte, LFTs, RFTs, and urine test for pregnancy. How does that sound to you?
Yeah, doctor. Sure.
All right. So, thank you so much for answering my questions so far. Any findings?
No.
All right. Well, regarding the contraception you have asked,
2 minutes.
I asked, I forgot to ask you an important question that when did you have your last sexual intercourse?
Yeah, doctor, yesterday I told you that we had unprotected sex yesterday.
All right, all right. So I would there are two types of emergency contraceptions that we have. One is about what you know, that emergency a morning after pill, and there is another one called intrauterine device, in which we place a small device in your womb, and that also provides emergency contraception. So, what would you like me to give you?
Well, doctor, I think pill will be great.
All right. So, well, Julia, all right, you can take this medication for within the 72 hours, and that means 3 days. Is that okay?
Mm-hmm.
All right, Julia. Well, regarding your relationship, there's something that is quite concerning, and I would like to talk to you. Is that okay?
Okay, doctor, what you mean to say?
Well, Julia, I'm afraid that you are having a relationship with your teacher that is not appropriate. And I'm afraid that this is something that I have to, we just can't hold back. We just can't keep it confidential because, that can have some serious consequences for your own safety. Don't you think so?
Well, doctor, I think I'm happy with the relationship.
Hello.
Hello, doctor.
My name is Saima, one of the junior doctors working in the department. Can I please confirm your name?
Yes, doctor. My name is John.
Nice meeting you, John. So I can see that you are here to talk to me regarding your mother. Am I right?
Yes.
All right. So can you please confirm the name and age of your mother first?
Yes, doctor. Her name is Emma and she's 65.
All right. So how can I help you regarding her?
Actually, doctor, like my mother is here in the hospital and I'm trying to talk to consultant and doctors about her, but they're not giving me any positive response. And whenever I am trying to call them, they're not nobody is letting me talk to a doctor, and I'm not happy with the treatment of my mother here.
Okay. Well, John, I'm really sorry that you felt that way. And I apologize on behalf of my team that you have to face such an inconvenience. And however, I'm here to talk to you regarding your mother, and I'm here to talk to you regarding all of your concerns. So please feel free to talk to me about anything you want to. Is that okay?
Yeah, doctor.
So I would like to ask you a few quick questions to know to get a better understanding that what do you know about your mother. Is that okay?
Okay.
So can you please tell me what do you know? Why was she admitted in the hospital in the first place?
Well, doctor, she was having some problem with her heart, and then, like, she's living in a care home. So they called me and they told me that they have shifted my mother to the hospital. And since that day, I am trying to get some update about my mother, but nobody is answering my phone and nobody is telling me anything about it.
All right, all right. I can see that you're really concerned for your mother, and I can't even imagine how are you, what you are feeling right now. Well, can you know? Do you know that what has been done till now for her in the hospital?
No, doctor, nobody has talked to me about that. Because
Mhm.
I'm not able to meet any consultant and or any doctor. There are some rude nurses. When I'm calling them, they are telling me that come to the hospital if you want to know about your mother. So I don't know anything about it. Just one thing that somebody has told me that they have seen some blood in her urine bag. And I'm so worried about my mother. What happened to her, doctor?
John, I can understand that you are really worried and concerned for your mother. And believe me, anybody in your place will feel that way for her mother. you know. But however, I would like to ask that you told me that the nurses on the phone called you, asked you to come to the hospital and talk about your mother's condition. Have you, from this day before, have you come to the hospital to talk to any of the doctors?
Yeah, doctor, 2 days ago, I came to the hospital, and first they told me that the doctor is busy in some meeting, and I waited for
Mhm.
2 hours. And after that, when I talked to the doctor, he said he don't know anything about my mother. He said that on my face, and I was waiting for 2 hours, and then nobody. I was not able to get any answer for that. That's how you are treating the relatives here.
Oh, I'm so sorry to see that you have such inconvenience. However, I would like to confirm one thing that had you, was at the planned meeting with the doctor at that time?
No, doctor. Like I came here and then they told me that he will be free in 2 hours. So I was waiting for him. And then when I talked to him, he said he don't know anything
Mhm.
about my mother and he have many patients to see. So he went from there, doctor.
Mhm. All right, John, I can see that it's quite difficult situation for you. Well, mostly the doctors in the hospitals and the nurses, they have some schedule in the mornings. Mostly, they have some rounds to carry on, and there are a lot of things that are happening at that time. They have the treatment plans to make, the management plans. However, it is a better idea if you come to the hospital with an appointment, so that the doctors and the nurses will have an idea that you are coming to talk about your mother, and they will be able to get a quick review of your mother's condition, and they will address you in a better way. How does that sound to you?
Well, if that's how things work here, then I can do that, doctor. But still, those nurses and that doctor, they misbehaved with me, and I just want to just want to complain against them.
Well, I really, really apologize on the behalf of my team members if you felt that way, that they misbehaved with you. And I will look into the matter and I will talk to them and see that what's going on. And if they have something to say about it, they will come and speak to you regarding it. How does that sound to you? Would you like me to tell you about the management we have done for your mother in the hospital?
Yeah, doctor.
Mhm. So, right now, and as you know, that your mother was admitted here in the hospital, and she was under treatment, and you yourself mentioned that someone told you that she has some blood in her urine bag. Well, regarding that, we have taken that into account, and our consultant has ordered some investigations for that, and the results are awaited. And don't worry, once the results are here, we will inform you regarding it as soon as possible. Is that okay?
Doctor, is it something serious?
Well, I think the best idea would be to wait for the test results right now, because they will give us an idea that what is it, because there are a lot of reasons that would be possible in a hospitalized patient. It's too early to say whether it is something serious or not. It might be something that is treatable, and if it is something serious, we will keep you on board. Is that okay?
Yeah, okay, doctor.
Well, regarding your concern regarding the doctors and the nurses, I assure you that I will talk to my seniors regarding it, and I will inform them that you have some concerns, and I will also talk to my ward manager regarding it. And it's a good thing if I ask them to come to talk to you and speak to you first. Is that okay?
No, doctor, I just don't want to talk to them, and especially that doctor. I don't want him to be around my mother. I just want to complain, or I just want to talk to your senior about them. That's it. Okay, next.
All right.
You done reading the task?
Yes, I am done.
Okay.
There are a lot of things. All right. Hello,
Hello, doctor.
my name is Saima, one of the junior doctors working in the department. You must be Mr. Jackson, am I right?
Yeah, doctor, I'm Jackson.
Well, how can I help you, Mr. Jackson, today?
Well, doctor, somebody has told me that my mom is getting discharged today, so I'm here because I have some concerns about it.
All right. Well, I'm here to help you and address your concerns. But can you please confirm the name and age of your mother first?
Yeah, her name is Mrs. Maria, and she's 82.
All right. Okay. So before we discuss about her discharge plan, I would like to ask you that what do you know about your mother's condition?
Well, I know that she was having a fracture in her hands few weeks ago,
Okay.
and then she came here and you did some treatment on her, and now you are discharging her. But doctor, I don't think it's the right idea.
All right. Well, may I know why do you think so that it is not the right thing to discharge her right now?
Because I think you have missed something. You know, she is so old and she cannot take care of her properly. So how can you discharge her? You must have missed something.
Well, all right, Jackson. I would like to ask you a few quick questions regarding your mother, and then I will tell you that what have we done till now for her. And even afterwards, if you think that you have any concerns, well, we can talk about them also. Is that okay?
Yeah, okay.
All right. So, does your mother have any diagnosed medical condition?
Yeah, doctor, she's having high blood pressure.
All right. And is she taking any medications for that?
Yeah, she's taking.
Mhm. All right. May I know with whom does she live?
She's living alone, doctor. That's why that's why I'm not feeling that it's the right thing to send her home because I'm working in some other state and I cannot come to visit her occasionally, so like more frequently. So I don't think it's the right idea to send her home.
Well, I can understand that being a concerned son, you are really worried for her health and for her safety. All right, we will talk that about it in a moment. Well, have you seen her in the last 12 hours? Your mother?
Yeah, I saw her yesterday.
Yeah. How is her mobility? Is she able to walk well?
Yeah, she was telling me that she's using some walking aids for that.
Hmm. Yes, yes, she is. Yes, she is. And may I know about her house conditions? Is she able to perform her daily activities on her own?
Yeah, previously she was able to perform, but I'm not sure will she be able to do all that now?
Mm-hmm. Okay, well, we will talk about it in a moment also. Well, has anyone else been here to help her with her normal errands mostly?
No, doctor.
Uh, All right. Thank you so much for answering my questions so far. Well, Jackson, We have done some investigations. We have checked her blood for any abnormality, and we have also done some urine tests to see if there is any infection or not. And fortunately, all of them are normal. All right.
But doctor, like I said, she's so weak, and
Mhm.
I don't think that there must be something wrong,
Mhm.
doctor. Can you please do all these tests again?
Uh, well, actually, in addition to these tests, there are certain other tests like ECG and X-rays of her body, different bones we have done, and all of them are normal. And we have also conducted the best interest meeting, and where all different departments, including the physiotherapist, occupational therapist, the nurses, doctors, along with social services, has reviewed her condition, and they are satisfied that she is fit to go home, and they have also decided regarding her care at home. Would you like me to tell you about that?
Yeah, doctor. Yeah, sure.
Well, we are not going to ignore her once she is out of the hospital. We have make sure that she will be regular with the follow-ups at fracture clinic. She will be asked to come there twice a week. Is that okay?
Okay.
And in addition to that, we have also offered her home to hospital service. By that, we mean that caregivers will come to her home and help her regarding different errands, and they will come to visit her twice every week. How does that sound to you?
Mm-hmm. Yeah, doctor. Yeah, that sounds like a plan.
Well, yes, actually, well, right now we have decided this. However, we
Two
can review the
minutes.
plan as her recovery, and we are going to keep her under eye, and we can, all these services, social services, occupational therapists, they can review her condition on the basis of her recovery with the time. Is that okay?
Okay, doctor.
Well, do you have any other concerns you want me to address?
Yeah, like you told me that home to hospital service will be arranged for her. So,
Mhm.
what else you can do to help my mother?
Well, regarding that, there is some services that you told me that she is living alone. We can also offer her some services called befriending services. Have you heard about them?
No?
Well, regarding these services, there are some volunteers who come and they can be like a friend. They can get a telephone call with with an elder person who is living alone and talk to them on phone, or either they can join them for a chit chat even at home or at some appointment, a doctor's appointment, or somewhere cafe.
So, your next task is this one, Saima. You can take a picture of this, and after we will, I have to start a new meeting.